Hello, my name is Jeff, and I want to talk to you about my journey through my shoulder injury in the past. So, when I was 18, I actually had an injury with my shoulder, and I'm actually a baseball pitcher. I'm a right-handed pitcher for the university team, and I've been playing baseball ever since I was 4 years old. I've been playing competitively since about 10 years old, and it's been my dream to always play in the Major League Baseball. So when I signed this deal, I started experiencing shoulder pain in my right shoulder. It was kind of slowly progressed over time, just kind of after the games, but it slowly got worse and worse and worse. Previous injuries, though, I haven't had any previous shoulder injuries before this, so I was a little concerned. But now I was getting the pain kind of throughout the rest of my shoulder, and I was getting really worried. So then I went to a physician and got my shoulder checked out, and they actually diagnosed me with a full thickness tear of my right supraspinatus tendon. So due to this, they actually recommended surgery for me. So I received arthroscopic surgery, and then I came here for physiotherapy.
So my name is Rhiannon, and I was the first physio to see Jeff post-surgery. So he first came to us at about 1 week post-surgery, and he had strict orders from the surgeon to keep his shoulder immobilized in a sling for 4 to 6 weeks post-surgery. And therefore, we could not perform a formal assessment to obtain clinical findings at that time, but we decided that once he was out of his sling, we would kind of get better findings. So at the time he first came to me, he reported a constant pain of about 4 to 10 and was regularly taking extra strength Tylenol. The pain often made him restless at night, so he would lose some sleep. And so for our first assessment, we kind of just said, as his arm was going to be in a sling, he would experience some stiffness, decreased passive range of motion, and his muscles were going to get weaker. I was able to assess his passive range of motion of the shoulder. So he had about 90 degrees of flexion, 60 degrees of abduction, 45 degrees of external rotation, and 40 degrees of internal rotation. After the initial assessment and kind of talking more with Jeff, our main concerns were controlling his pain and inflammation, his limited range of motion and strength, the decreased functional use of his arm, his difficulty sleeping, and then there was also kind of some psychosocial issues of him not being able to play baseball that we were also a bit concerned about. So as a team of physios, we got together, and our treatment program we wanted it to be based on the stages of tissue healing and the literature that went along with that. We wanted to focus on restoring range of motion through adapting treatment methods based on the client and performing active therapy. So for about the first 6 weeks post-surgery, I mostly worked with Jeff, and Giangarra outlined some precautions that should be taken at this time post-surgery. So therefore, I will educate Jeff that he should not perform active range of motion of his shoulder, no lifting any heavy objects or any objects really, no reaching behind his back or excessive stretching of the shoulder or sudden movements. He should also avoid putting any weight through his hands. So the goals for the next few weeks of Jeff's rehab would be to protect the repair, control his pain and inflammation, and begin gentle passive range of motion. As both Millet et al. And Conti et al. Recommend early mobilization after rotator cuff repair and suggest passive range of motion, this is going to be a main focus for the next little while for Jeff. Okay, this is the pendulum swing. What I need you to do is to bend over any surface and let your arm hang, and then rotate your hips around in circles to let your shoulder move in circles. Remember, you don't want to actively move your shoulder at all. Okay, so next I'm going to teach you passive range of motion for the shoulder. So we're going to use the broomstick, and you're only going to be activating the muscles in this arm and using this arm to pull this arm up. So what I want you to do is with this arm, pull the broomstick up this way, and we're only going to go to 90 degrees, so straight up. And you can stop there and go back down just using that arm and letting that arm follow. You want to make sure you don't get any elevation in your shoulders. Within the first 6 weeks post-surgery, I would also recommend that Jeff perform some aerobic activity, such as going on a stationary bike without using his arms for about 30 minutes 4 times a week and keeping it rather low intensity.
Hi, my name's Sarah, and I'm the physio that worked with Jeff from weeks 7 to 12. So, following a full assessment with Jeff, now that he was out of the sling, we found that he had full passive range of motion, but was still lacking in active, with only 160 degrees of flexion, 70 degrees of abduction, 70 degrees of external rotation, and 60 degrees of internal rotation, with extension and adduction full range. His strength was a grade 3, and his pain was a 3 out of 10, with movement but no pain at rest. The goals of the treatment at this stage were to increase active range of motion, strengthen the glenohumeral joint and the stabilizing muscles, and based on Van der Meejden's studies, and to decrease pain and gain back functional activities. The same precautions exist from the previous stage. For this next exercise, we're working on the muscles that help stabilize your shoulder. So put something under your shoulder to support it so that you're not putting any pressure through it. And then you're going to work on squeezing your shoulder blades together. At this stage, we educated Jeff on continuing the pain management and aerobic activity as before, and that he could gradually add in low impact core and strengthening activities as long as they avoided the precautions at this stage.
My name is AJ, and I was a therapist that saw Jeff from weeks 13 to 18. At that time, he was presenting grade 3 muscle strength. He had full passive range of motion and also full active range of motion. Our goals for that duration of time was to maintain and strengthen his full active range of motion, gradual restoration of the glenohumeral and scapular strength, and gradual return to functional activities. Some precautions that we had to be cognitive of was no lifting of heavy objects above 5 pounds, and the exercises should not be painful. So those were our goals going forward. So Jeff has been taught the D2 pattern here, and this is going to mimic his throwing motion. Now this is to kind of facilitate some of that neuromuscular facilitation. So his shoulder can know where it is in space, and also this is going to also add some strength component to it. So for the active range of motion, we want to make sure that Jeff is in good postural alignment. So we want his shoulders retracted, and we want him down here. We want to make sure that the traps are not influencing the glenohumeral, and that we have good room for his scapula to move in space. So right now, Jeff is going to perform flexion with this shoulder here, making sure that his trap is not involved and it's coming from the glenohumeral joint while allowing the scapula to move. And after that, he's going to do some abduction. Make sure that he's not bending from the back here, so it's all coming from the glenohumeral. Very nice. And letting that scapula move into upward rotation.
Hi, I'm Fabian, and I saw Jeff for the remainder of his therapy. First saw him at 19 weeks, and between 19 weeks and 22 weeks, some of the first clinical findings we saw was some adequate strength and stability, so we can slowly start to progress to some more functional related activities, and this is consistent with the expected remodeling stage of tissue healing. Some of the goals we have established is just kind of the return to functional activities and to remain full non-painful range of motion. We want to ensure there's no impingements or any abnormal healing that's occurring. We want to improve his strength, obviously, and get him to improve power and endurance, and advanced general conditioning exercises will be prescribed. Some of the precautions that we need to consider are increasing things too fast. As athletes, there's a tendency to want to return too quickly or pushing too hard because you think it's going to progress your recovery faster. However, we need to ensure that he does have and follows his prescribed rest days so that there are days between sport and rehab days. So systematic review conducted by Van der Meijden et al. Established that a return to work or return to sport should be initiated between that 18 to 20 weeks post-surgery, and the sport days a week, and ensure there is at least a rest day or two, that 24 to 48 hours, just depending on the muscle response to the treatment. So for first prescription here, what we're going to have Jeff do is go through the cardinal planes of motion using the TheraBand as resistance, and pulling up until his end range. As well as the cardinal planes of motion, we'll also have him going through the scapular plane to ensure that we have a good congruency between cardinal plane and scapulothoracic junction. All right, so for the next exercise, we'll have you come chest onto the bench. And what we're going to do is we're going to have him holding a baseball, bringing your shoulder into extension, abduction, and external rotation. Good, this is the starting position, and the focus of this exercise is Jeff is going to drop the ball and try and catch it before it hits the floor. The focus of this is to control the arm in a gravity-assisted position, coming forward to control that movement. We don't want any of the motion coming from rotation within the trunk. We want it purely in the shoulder and to focus on shoulder stability and core stability. And another functional exercise we're going to do here for Jeff, just to get him back to that throwing motion and to keep things more functional and to open up that mobility and range with control, is to have him in the loaded position to throw the ball at the bench and catch it. So this is working on mobility, the throwing mechanics, core stability, and proprioception. So from 23 weeks until the year anniversary of Jeff's surgery, we're gonna continue to progress through his program. So some of our clinical findings on our reassessment of Jeff after this previous sequence, we've discovered that he has regained full range of motion, strength is 5 out of 5, and he's pain-free. So far so good, everything's coming along nicely. So our goals here on out are to progress his functional ability and his strength, and we want him obviously to return 100% to sport by the end of this 1 year for sure. Some of the precautions that we have to consider are loading of the shoulder too quickly, and to ensure that Jeff is still resting it and recovering and doing the recommended procedures for recovery following workloads. So, and we also need to establish education for Jeff and how to have him safely return to his previous exercise programs that he does have with his team. So some of the exercises he's doing outside of our clinic include the squat and bench press and the running program. We will assess those in the clinic to ensure that his biomechanics are good and he's moving through them without pain and doing them efficiently. So one of the exercises we're going to have Jeff doing to improve some of the mechanics of his throwing, we want to emphasize that he's getting good core rotational ability at the start of his stance throw in his pitching phase. So Jeff will have his hips square, 90 degrees to the wall, or parallel to the wall, and he's going to rotate the ball into the wall and catch it. His hips are going to stay in the frontal plane, nice and square, and it's going to come from the core. So the next exercise kind of touches on some more of the core stability as he's going through these loaded throwing motions. We're going to be starting from a high chop position. So what Jeff's going to do is the first motion is going to be initiated through the shoulder, pulling the shoulder in, having good compression here. And keeping this hips square, he's going to rotate across through the thoracic spine and extend through the shoulder there as if he was to be following through in a throw. So what we're going to do for a little bit of dynamic shoulder strength and mobility control is we're going to be having Jeff perform a landmine push. So starting in a mini squat for the knees bent, Jeff's going to explode, bring the bar up to his right shoulder, and then Jeff's going to step through with his left leg and push through with his right arm.
Well, I want to thank the physiotherapy team here because they did a great job. It's 1 year post-surgery. I'm fully back with the team, and now I'm the starting pitcher for the university team here at the school.
So just squeeze it